Welcome to Nursing Mindset. In these short videos, we'll focus on how nurses think, grow, and provide safe, compassionate care. Today's nursing mindset is all about professional identity, who you are becoming as a nurse. When most people think about nursing, they picture the visible skills nurses perform every day. Things like starting IVs, administering medications, changing dressings, responding to emergencies, or performing CPR. Now, those skills are certainly important. In fact, over the next several semesters, you'll spend countless hours learning and practicing them. But here's something interesting to consider. Skills alone don't define a nurse. What defines nursing is how we think, how we treat others, and how we practice. That's what professional identity is all about. Professional identity isn't something you earn in a single day. It develops through every class, every clinical experience, every patient interaction, and every decision you make. So let's begin in the center of our tree. At the heart of professional identity is being committed to people, to practice, and to purpose. Everything else grows from that commitment. So let's begin with the left side of the tree. Everything starts with how nurses think. Unlike many professions, nursing requires us to make decisions in situations that are constantly changing. Patients rarely fit neatly into a textbook description, so we must gather information, recognize important cues, identify priorities, and make thoughtful decisions. That's why critical thinking is one of the most important skills you'll develop in nursing school. Professional identity also includes integrity. Now, integrity means doing the right thing, not because someone is watching, but because it's the right thing to do. It means being honest, admitting mistakes, and always acting in your patient's best interest. Another essential characteristic is accountability. Being accountable means accepting responsibility for your decisions and your actions. If you make a mistake, you acknowledge it, you learn from it, and you take the appropriate steps to protect your patient. Finally, there is reflection. Reflection means taking time to ask yourself, well, what went well? What could I improve? What will I do differently next time? Reflection is one of the reasons experienced nurses continue to grow throughout their careers. Now, let's move to the center of the tree. Nursing is built on relationships. Every patient you care for is more than a diagnosis or a room number. They are individuals with their own fears, their own beliefs, their own cultures, their own families, and own life experiences. Compassion means recognizing the whole person, not just the illness. Advocacy means speaking up when something isn't right or when a patient cannot speak for themselves. Communication isn't simply talking, it's listening. It's asking thoughtful questions and helping patients feel heard. Sometimes patients don't need us to immediately solve a problem. Sometimes they simply need someone willing to listen. Finally, respect. Respect means honoring every person's dignity, their values, their beliefs, and of course, their individuality. Patients may forget exactly what you said, but they'll often remember how you made them feel. Now, let's look at the right side of the tree. Professional nursing isn't based on personal opinions or habits. It's guided by professional standards, ethical principles, and evidence-based practice. Professional standards provide consistency and help ensure every patient receives safe, competent care. Ethics helps us navigate difficult situations when there isn't an easy answer. Evidence-based practice means combining the best available research, clinical expertise, and patient preferences to make informed decisions. Throughout everything we do, patient safety remains our highest priority. And that means every assessment, every medication, every conversation, and every intervention. All of those should ultimately support safe, high-quality patient care. Professional nursing also requires lifelong learning. Healthcare is constantly evolving. New medications, new technology, new research, and new best practices emerge every year. Graduation isn't the end of your education. It's the beginning of a career dedicated to continual learning. Now, look at the roots of the tree. Trees don't survive without strong roots. Neither does professional nursing. Everything we've discussed is grounded in 3 essential foundations: trust, patience, and society. Patients trust us during some of the most vulnerable moments of their lives. They invite us into their homes, their hospital rooms, and often into deeply personal moments. That trust isn't earned because we wear scrubs or have RN after our name. It's earned through integrity, through compassion, through accountability, through respect, through professionalism. Every interaction either strengthens that trust or weakens it. As you begin nursing school, it's completely normal to focus on learning the skills. You're excited to master injections, physical assessments, medication administration. At some point, you'll get to insert an IV, and all the technical procedures you've been looking forward to learning. Those skills are absolutely important, but never lose sight of the bigger picture. The goal of nursing school isn't simply to teach you what to do, it's to help you become the type of nurse that patients trust, colleagues respect, and the profession is proud to call one of its own. Professional identity isn't built overnight. It's developed one class, one clinical day, one patient interaction, and one thoughtful decision at a time. Remember, every safe nursing decision begins with the right mindset. Keep developing your nursing mindset, and we'll talk in the next video.